for our speaker, who's having some technical difficulties this morning, so we'll just wait a minute or so. Good morning, everyone, and welcome to Grand Rounds. Our speaker today is Dr. Crystal David, PharmD. Our program today is underwritten by an educational grant through OSU Medical Center, Graduate Medical Education. A disclosure statement has been signed and is on file in the GME office. Dr. Crystal David, PharmD, earned her Doctor of Pharmacy degree from Creighton University in Omaha, Nebraska in 2013. Following graduation, Dr. David performed her ambulatory care residency at the University of Oklahoma Health Sciences Center. Board certified in pharmacology with an emphasis in family medicine, hepatitis C, diabetes, ambulatory care, and transitions of care. She has been a clinical pharmacist at OU's Health Science Center, Cherokee Nation Health System, and the Oklahoma State University Medical Center. Along with being OSUMC's clinical pharmacist, Dr. David is a clinical assistant professor in the Department of Family Medicine. The Cloud CME activity code for today's Grand Rounds is 1584. That's 1584. Please welcome Dr. Crystal David.
Hey, thanks, Dr. Alex. Good morning, everybody. Sorry, I was a few minutes late. I had to update my Zoom, which I just used yesterday, so I'm not sure why it needed updated today, but you know how that goes. So let me get my presentation pulled up here for you. Okay, can you see my presentation?
Yes, we can.
Great, thank you so much, Heather. All right, so as she said, like today I'm going to talk to you about the Resident and Fellow Quality Improvement and Patient Safety Symposium. And last year during Grand Rounds, I kind of did an overview about what quality improvement is and kind of the steps to completing a quality improvement project. And some things that we noticed are that some of the residents and participants last year weren't entirely sure like how to put together a poster and what the final product needed to look like. And so we thought that this time might be better suited to talk about what the expectations are and giving some tips and tricks on how to put together your final presentation for the Quality Improvement Symposium. If you have not already decided to participate for this year, still, I think, pay attention because it's not too late. Even if you don't have a project, there's plenty of time to come up with a project, and we can do this. And so today we're just going to kind of talk about some generals. So this could apply for other things later down the road too that may not just be for the Quality Improvement Symposium that we have here. Okay, so I don't have any conflicts of interest. And as an overview, just so you know, like why we do the Quality Improvement Symposium and what it's about, I wanted to talk about CLEAR. So CLEAR, as Dr. Alex has talked about in Grand Rounds before, I know, is the Clinical Learning Environment Review. And so this is a program that's designed for U.S. teaching hospitals, medical centers, health systems, and other clinical settings that are affiliated with ACGME accredited institutions. And they come in with periodic feedback and they help address 6 focus areas. So these 6 focus areas are here on the slide: patient safety, healthcare quality, teaming, supervision, well-being, professionalism, and then diversity, equity, and inclusion. So you've had a variety of topics about this during Grand Rounds in the past. And so today, like I am part of the healthcare quality pathway. So with the healthcare quality pathway, we really are talking about engagement in healthcare quality in general. And one of the subtopics of that is engagement in quality improvement projects and clinical site initiatives to help reduce healthcare disparities. So we're going to focus on healthcare quality and kind of what it's about. So just very general, right? It is what it sounds like. It's about making healthcare safe, effective, patient-centered, timely, efficient, and equitable. So part of healthcare quality is quality improvement. And so when we're talking about quality improvement, why is this important? And so it's important because it helps us improve patient care, address barriers to care that we might see. And so like one of the quality improvement projects from last year was about addressing social determinants of health and the barriers that patients have there. So it was a really good example. It can help us adhere to national guidelines. So you can look to see, you know, are we treating community acquired pneumonia like the IDSA guidelines recommend, and look from there and see like what could we do to improve our adherence. And then also engaging in quality improvement is a required part of residency. So as for that, we have a quality improvement symposium here with our consortium. And what this is a way to allow us to showcase what our residents and fellows are doing, how they're involved in interprofessional quality improvement. So this is going to help us meet the clear healthcare quality pathway too. And this symposium also allows each of you the opportunity to learn from other programs. So you can look at the other posters, you can engage with the other authors and get ideas on ways that maybe you can improve healthcare at your sites as well. So you can say, oh, wow, I hadn't thought about doing that, and something you can implement where you are. So I highlighted interprofessional on this slide because that's a really important part of the expectations for our quality improvement symposium and for CLEAR. And so interprofessional meaning involving two or more professions. So we've seen a lot of projects in the past that combine, you know, nursing and physicians, or physicians and pharmacists. And we'd really like to see incorporations of respiratory therapy, occupational therapy, the patient service reps in your clinics or in the hospital, and then, you know, lab. There's a lot of different ones, so I didn't list everyone, obviously, but it's a really important aspect of quality improvement that's going to be very like widespread in your healthcare system. So be thinking about who else can we include in here, not just the residents or faculty that are in your department. But then also like interdepartmental is really important as well. And so projects that involve two or more departments are also very strong projects. So in the past, we've seen surgery and emergency department, emergency medicine, they have had combined projects. Family medicine, they paired with the HAN, which is the Health Access Network, for a project last year. Let's see, I think the emergency medicine department and behavioral health did a project together. So also be thinking about how you can work together with other departments during your quality improvement project. And then there's tons of other collaborations that I didn't think of that I know that maybe you can think of that's also going to help us with this interprofessional concept here. And so interprofessional, remember, just being very vague, not exactly what we think of as two or more professions. So the Quality Improvement Symposium, this is the 6th year for it, and it started in 2018. And so for the first 2 years, it was an in-person like poster presentation at OSUMC. So we would print out a physical poster and you would stand by it. So if you've ever been to other poster presentations in the past and you have presented data that you have collected, that's kind of how it was. You stood there by your poster, the judges came around, they had some questions, they would ask you, and then other people that might be interested that were in the area could also just come in and look and browse and talk to you all and the authors about their presentations. Well, in 2020, that had to change a little bit, right? And so we went to a virtual symposium for that year. And then what we ended up doing is just hosting the presentations online. And when we did that, it was really just putting the posters on the website that was hosted by OSU, and the judges would go to the website, look at the posters, and then judge from there. And there really wasn't a lot of interaction. And so we did that for a few years. And it works really great because it allows a lot more participation from some of you who aren't near here in Tulsa. So you didn't have to worry about spending the whole day traveling here. And so we did see a lot more participation from a much wider variety of our programs. So that was really a strong point of changing to virtual. This year, we are going to still remain virtual, but we're going to do a pre-recorded video component. So hopefully this will kind of mirror what a real poster symposium would look like. And so each poster presentation will be a real presentation, and I'll go over this in a little bit, but about how to pre-record a presentation on Zoom, and then that recording will be on the website with your poster, your actual poster, so that judges and anybody who wants to come view the posters can listen to what you think is the most important part about your poster. And then next year, the hope is that we will be back in person, and it'll be an expanded symposium. And so there'll be more details for that to come in a little while. So if at this point you're kind of thinking, yeah, I've already done my QI project 2 years ago, and you've kind of tuned out, I do want you to listen for like 2 more minutes before you decide you may not be doing a QI project this year. So this year's symposium will be on May 16th. So that's pretty traditional. We have it in the middle of May. So like I said, you have plenty of time to still come up with an idea and collect data on it and create a poster for it. So this is when the posters and videos will go live for the public viewing on our website. And then there will be winners. And so I did say winners. And so people who have been here in the past know that like maybe they know about winning. So yeah, so we're going to talk about that for this year. So before I do, I just want to offer a really huge thank you to the Osteopathic Founders Foundation. They have generously supported this year's Quality Improvement Symposium and are the ones that are providing the funding so that we can have awards for the program. So last year, and I believe many of the previous years, kind of here has been what the winners have. So the judges will determine who gets first, second, and third place. And so first place was $300 last year, second place was $200, and third place was $100, which are really fantastic prizes, and you'd split it among the authors of your project. And so for this year, because of the Osteopathic Founders Foundation support, we're able to expand the amount of the awards. And so for third place this year, the total is going to be $500. So you can see third place will be the same as all places last year. So this is really exciting information. And for the second place award, it'll be $1,000. And for third place, $1,500. So very generous, and I think hopefully like motivating for some to like help encourage you to spend, because I know you have to spend a lot of extra time on this that you aren't necessarily given. And so this could be helpful for you. Okay, so I wanted to review a few past projects to give you an idea in case maybe you are new to your program or just haven't had a chance to look online at some of the projects. And so last year, here is an example of the third place poster. It was mainly a pharmacy-driven project where they looked at the management of heparin-induced thrombocytopenia. So you can see this is the poster they created for it. And these are all available on the website. And I think I put the website here, medicine.okstate.edu. It's on the GME website under Quality Symposium, but you can Google like OSU CHS Quality Improvement Symposium. It'll take you to it, and you can see all 5 years of projects. Okay, so here's second place. It was medication-assisted therapy in the emergency department. And so you can see this is one that was a collaboration between emergency medicine and behavioral medicine. So they were looking at buprenorphine initiated in the emergency department. And then the first place one from last year was the one I mentioned earlier. It was utilizing social determinants of health screening in primary care. And this was with family medicine, and we partnered with the Health Access Network. And so it was interdepartmental. This one was also interprofessional. There were some nurses that were able to help with this program as well. Okay, so then it's like, okay, well, maybe I have an idea. We have started it, maybe you haven't started it, and that's okay too. But how do I get my poster? How do I get my information to look like this in the end? So yours doesn't have to look exactly like this, but I am going to talk about how you can get there. Okay, how to create this final product. And I've mentioned this a couple of times, but it's not too late. We do have a timeline in the handbook. So maybe you have seen this handbook, and I hope you have. Lisa Cummins, she has sent it out. And if it didn't come directly to you, maybe it went to your program director and they were able to send it on to you. But in this handbook, we really lay out step by step what you can do. There are modules that you can go through if you want some additional training on quality improvement. And then we have it like more condensed, like what we expect, what to look for in a project, and kind of a timeline. So by January, I think it was like January 7th, have your idea emailed to the quality symposium team. But these are not hard and fast guidelines, okay? So don't be like, oh, well, January 7th is past, that was 3 days ago, now I can't participate, because you absolutely can. We had just worked backwards from the final product with a timeline to kind of help with some time management, just to kind of keep people on track and give you an idea of how long it might take to do different aspects of it. But it's absolutely not too late. So please, if you have an idea or you're interested in participating, we would love to have your participation. And at this point, even if you don't have your idea finalized, you can send an email to the quality symposium email address that we have, and just say, hey, I'm interested in participating, and kind of give us a heads up, just so we're having an idea of what to expect. And then as you start finalizing things, you can just update us with those emails, like, okay, we have our project idea and here are the authors. The only deadline that's final in this thing is the May 1st deadline. And so that is when your final poster and your video are due to be emailed in. So before that, nothing is final. You can start it at any point. I mean, obviously starting on April 30th would not be a great idea. I mean, you would not have very good data collection for one day, but anything before that. So the timeline in the handbook is just to help you with time management. And then the final deadline is May 1st. So if you're like, okay, well, this is exciting, I do want to be a part of this, but I have no idea what I would even do a project over. This seems kind of overwhelming to pick something. Now, I would just encourage you to talk with others in your department, talk with the faculty in your department. They probably have some ideas of things. If you're an intern, talk to your seniors. Like, what are some things they've seen that they think like that you could, not you, but like that you all could do better. And then maybe even, you can talk to the nurses and see if there's something, they might have some ideas as well, because they see things from a different perspective than we do. And I think it's always helpful to get that perspective from a different profession when you're trying to come up with ideas like this, because we all see things differently, right? And then let's see what else. Oh, if you're on a committee in a hospital, talk to somebody on the committee, talk to the head of the committee. There's probably some ideas there as well. So I know there are a lot of ideas out there, and definitely there's something that we can get you involved in. Okay, sorry. Okay, so let's say, okay, well, I have my idea, but like, how am I going to get my idea to this poster? And that's really what I kind of wanted to highlight today as well, in case maybe you've never made a poster like this in the past. Okay, so for the guidelines, really, we recommend just creating your poster in PowerPoint. So if you've never done this, it's not too hard. You just have a slide and you can put in any component. So you absolutely can start from scratch, which can be a little difficult, but there are a ton of pre-made templates out there. You can look for one that you like online, but in our handbook that I mentioned, we have a link to the library, and then there's another link in there that have pre-made ones that are OSU specific, and they already have a lot of the details in there. And then you can just alter this with your information. So I'd really encourage you to start with a template, especially if this is the first time you have created a poster. But if you are the very creative type and you really like doing that, making your own thing, you can definitely start from scratch and just include the components. So the size we would like is 36 inches wide by 24 inches tall. And so, I know it sounds kind of weird, but there are directions in the handbook that show you exactly how to go and make that the size that you need. And this is important mainly because when we are in person, we print it out, and so everybody's will fit on the boards. But also when we host it on the website, if they're all the same size, then they all look the same when you're flipping through them on the website. You do want to name your poster with the assigned poster number. So when you email the Quality Symposium group, then you will be given a poster number, so poster 3, poster 5, and then that's what you will name it. So yours would be like poster 5, social determinants of health, quality improvement 2023 for this year. And that's how you do that. And then that just makes it easier for us on our end to know for sure which ones we have, which ones we don't have. And then when they're loading them on the website, they're connected appropriately to the correct authors and titles. And then I cannot stress this last bullet point enough, but utilize the checklist in Appendix G of the handbook. There is a very specific checklist, and you can say, okay, I've done this, I've done this, I've done this, and you will know that you have included everything you need to include in your poster, and there won't be any questions about whether you left something out or not. The poster sections, there's a header, and so in your header, it's really important to have the title of your project, and then list the faculty advisors that have helped you with the project and their credentials. So, DO, MD, PharmD, whomever your faculty advisor is. And then you need to list all the authors who participated in the project with their credentials and the PGY status. And so this is really important, and it'll be part of making sure that you have met all the details that are required for this. So this is just so when people are looking at your poster, they know who was responsible for collecting this amazing data, and kind of just like get a good idea. And so, you have your nurses, RN, LPN, make sure that their credentials are on there. Not everybody obviously will have a PGY status, but if you do, include it. And then you need to include your institutional affiliation. So for every poster, you'll either need to have the most current OSU CHS or OMICO logo on there. So everybody needs to have one or the other depending on their program. And then you can also include your clinical sites logo. So I have 2 examples to show you of headers from the past. So the top one is the social determinants of health screening. So you can see the OSU CHS logo there on the right. And then you can see their authors. So Chris Gwynn, DO, he's got his credentials, MPH, and his PGY2 status. Then in the middle, they put the faculty advisors, and they put their credentials, DO, MED. And then also listing the nurses who were part of the program. And then the bottom one I picked because I showed that you can see that they use the OSU CHS logo, and then also their institutional sites logo, so the Northeastern Health System logo. Okay, and then again, they were really great. They put their authors, their DO, PGY status, and their faculty advisor with his credentials of MD, and then Northeastern Health System as part of the title. So something like this is kind of what we're looking for. Maybe you're thinking, why is she going over this? But I'm going over this because every year we probably have to send back like 75% of the posters to have corrections because this part wasn't done correctly. And so it is check marked in the list for you. Okay, also the next section would be your background section. So when you're creating your background section, you want to talk about really like what the gap of care is that you saw. And then if there's any data that you collected before starting your project, you can include this here and really talk about specific areas of care that you're focusing on. And this is where you're going to have probably some references, because you're going to be getting information like, like community acquired guidelines say blah, blah, blah. And you would cite those references. So this is like your background of material. And then your project aim. So what are you planning to do with this project? And it's just a brief description, just 1 or 2 lines, probably no more than 3, about the goal of your project. You want to be pretty specific with your goals. So like if you did a background and you looked at community acquired pneumonia and you look to see like how adherent but like the group that you're looking at prescribing was to the guidelines. Let's say this would be in your background statement that 60% of patients who were treated between this date and this date in our hospital received appropriate community acquired pneumonia treatment per the guidelines, and that would be part of your background. And then your project aim would be, we aim to increase our adherence to the prescribing from the guidelines by 20% before or in 3 months or something like that. So just kind of be specific. And then you'll have like whatever your intervention is. So I would recommend when you're doing these backgrounds to like type this up like in a Word document or in something else, not directly into your PowerPoint, so that you can like wordsmith and play with it and get it how you like it. And then you can transfer that and copy and paste it into your PowerPoint. You'll also have a methods section and a results section, right? So here, I mean, you're thinking like 7th grade science fair, right? You know, methods. What did we do? How did we carry out the project? Include anything, like any cycles that you went through. So some of some QI projects are very, very short, and they maybe did like 3 cycles of a very short plan, do, study, act. Any tools that you used for this, and then describe the study participants, quality measures, data collection methods, and data analysis strategies. So this would all go in your methods section. And then the results are going to be a summary of the data that you collected and analyzed. It's not going to be, you're not going to really describe it a whole lot, but it is going to be like the summary. So you're going to really want to use like graphs and charts here so people can see your information really easily. When they're looking at it, they can see, what did you find out? What are your numbers? And this could be qualitative or quantitative. And then in the conclusion, what did you learn? And how can this be applied to future clinical problems you may encounter? And then a part that maybe you're not as familiar with if you've never done a QI project before. So those other sections are very similar to projects we may have done in the past, but you want a sustaining improvement / next steps section. So the templates that we have don't actually include this, but you can just copy and paste the conclusion section down and make it a new section and rename it. And so this is really important because this, you know, part of having a quality improvement program is like the what now. How can I do different next time? Or what are we going to do? Who needs to carry this information forward so that this becomes part of the plan in our institution? Who do we need to tell about these results? Like, this is really important information. And look what we found out. That can be like, now we can extrapolate this to every department in the hospital or every clinic in our health system. And so like, who needs to be informed of these results to make sure that this information is carried forward? And then of course, the reference section. So please don't forget the reference section. Everybody should have a reference section. There's going to be something in your background that you looked up, and so include that. And then here's an example of one of the templates that is on the library website. It already has the OSU Center for Health Science logo there. But if you needed to swap that out for the OMICO logo, you can do that. And you don't have to have this orange and black template. Like I said, you can change it. You can change the colors. This is just a really good way to start, and you can see like all the parts are there. And like I said, so you can see the different sections. They're named different than what we would like them to be named for a QI project, because this is more of a general research project, but you can just click on the word and rename it, right? And then over on the right side over there after conclusion, add in that section about the sustaining improvement. Okay. And then last but not least, I want to talk about the recorded Zoom presentation. So if you've never done one of these before and you feel like, oh gosh, that's a lot, she's asking for a lot here. It's really, really simple, I promise. And I think it's going to add a lot of value to our symposium. So people can hear what you think is most important about your presentation, about your poster, your project, what you did. So I would really encourage you to reference the Quality Improvement and Patient Safety Handbook, because there are step-by-step guides in there. And I'm going to go through them right now. But if you are like, oh, what did she say to do next? You're not going to want to go back and watch this whole video I just did. But it's laid out for you step by step, really easy. Okay. So why we're doing this, right? This is going to be in lieu of the in-person symposium. And it'll allow you to convey the most important points to your audience. No longer than 5 minutes, right? And it doesn't have to be 5 minutes. You can have one person on your team record the entire presentation, or if you want, you could all get together and each of you talk about a different section. It kind of depends on what your goals are and what's going on. But the one thing is I want to like stress here, this is not you just reading your poster, right? They will have that poster in front of them. They can read those words for themselves. This is you explaining what you did and what's important and what you found, okay? Kind of the elevator pitch thing. Okay, so how do you do this? So to record your presentation in Zoom, you're basically going to open your PowerPoint slide on your computer, right? And then sign into Zoom like you would normally do. If you don't have an account, I mean, I know we can sign in here, but like you can create your own account and open a meeting and then join it with audio. You don't need to join video, right? Because you're just doing an audio presentation of your poster. And then check to see that your microphone is unmuted, of course. And then this is what your screen will look like. Click at the bottom and do share screen. And then that's going to help share the PowerPoint that you have. Okay, so then this screen is going to pop up and this will show everything you have open on your computer. So you can see when I was doing this, I had like my snipping tool and a Word document because I was screenshotting all of this. And then I have my research day presentation there in blue. So I want to select that PowerPoint because that's what I want to show for my presentation. And when I've done that, I click at the bottom right down here and click share. So that's going to do share your screen. So it's going to open that PowerPoint up and you want to make sure that you are in presenter view in PowerPoint. So that's down here on the bottom right. I think there's other places as well, but you can see it's kind of like that little desk icon down there. And that's going to put you in presentation mode so that you can get rid of all this extra stuff on the outside here and you'll just see your poster. So you'll pull this up and then you want to make sure that the correct screen is being recorded. So this is really important, especially if you have like an extended screen or you have two screens. So you can tell here, I put a white box around this, but wherever the red and green is, that is the screen that's being recorded. So if you have two screens up and your poster is on one screen and that green and red box is on another screen, you need to change which screen is being recorded. Now, if you just have one screen, this is pretty easy. All right, so make sure you're on the right screen that's being recorded. And then over here on the upper right, you'll click these three dots. And when you click on them, it'll say record. So click record and then just start talking about your presentation. When you're finished, you will click those three dots again and click stop recording. So I told you it's really, really easy. Okay, so once you stop recording, you can end your meeting. And when you end your meeting, it automatically starts converting that to an MP4 file and will save it on your computer. So you don't even have to figure out how to save it. It's automatic. Then it pops up and it's saved there. So then I would say that really encourage you to listen to it and watch it for yourself, just to make sure that everything came across correctly. Your video and audio are good. And then when you're happy with it and you want to send it on, then email it to the Quality Symposium at okstate.edu. Again, all of this is in the handbook. And then the website will host the video and your like PowerPoint presentation. Okay, so how do we determine the winners? Just wanted to go over this real quick. There is a scoring rubric and you will be provided with a rubric so that you know what you're going to be judged on. So keep an eye out in your email for that final scoring rubric. It's currently being reworked. Anyway, so you'll be graded on your poster, right? So for the content and for adherence to the formatting guidelines. And then part of the rubric will also be about your Zoom video presentation. So we have judges from all across the consortium and physicians, pharmacists, nurses. Like again, it's going to be interdepartmental and interprofessional. And you'll have multiple judges that are assigned. So they will look at multiple presentations and you will have more than one judge looking at your presentation. And then we add up all of the scores. And that's how we determine who will be first, second, and third place. And so this, I guess, a time I'd like to say, like, if there's anybody in the audience, that's not a resident and not a fellow that would like to participate and be a judge, we would love to have you. If you've never judged a poster before, don't worry about it. We'll give you some guidance on that. And we would love to have your input. And so just let me know. And you can either email me or that Quality Symposium email. All right, so that is the end of my presentation. So I will take any questions that you have. Let me know if there's anything you need. So. And I guess if you can't think of anything now and you have some, that Quality Symposium at okstate.edu is a great email address. Lisa is really fantastic at checking that. And then I sometimes check it, but she's so good and she will stay on top of it. And we can get back to you really quickly on any questions that you have. She's a fantastic resource and I really appreciate her.
Thank you, Dr. David. Really appreciate all the great information, and we're looking forward to the new format and having the video accompany the poster itself. So thanks for all your great work. Thank you, Lisa, as well, for her great support. And I hope you all have a great rest of the week. So bye for now.
Bye.